Ahoy! Jamieson-Folland, the lifestyle aligner, helping you live the life you love. Today we're all about women's heart disease symptoms. You might say, well, why women? Well, interestingly, more women are affected by heart disease than men. More women die of heart attacks than men, which floored me. Not floored me, but it's something that I wasn't actually aware of several years ago, and I've been amazed at that. So why? What is the reason for that? Well, partly it's hormonal and partly physiological and anatomical. So estrogen or estradiol is a very protective hormone, and it can reduce for men when we go through, as we get older, as we go through menopause. And also we've got smaller blood vessels, and that means that we can be more likely to have micro disease in the arteries, if you like, and they can get more likely to be affected by things like plaque buildup. So those are the reasons, and there are 7 things that can happen for women that are sneaky, that we wouldn't necessarily realise are heart disease symptoms. They could be a prodrome for a heart attack, and I'm going to whiz through those here. We talk about, in this week's blog, we go into ways that we can help to prevent the likelihood of this occurring for us as women. These are useful for men as well, so please don't feel that this is, oh well, I'll just stop listening now, or I won't bother to read this week's blog, because there'll be value for you there. You may well know women in your life. So unusual fatigue, this is a classic one, and it's like that. It's bone tiredness. Okay, so it's a really feeling exhausted. Interesting, a 2020 study in The Lancet noted that 70% of women reported extreme fatigue in the weeks leading up to a heart attack. It's worth knowing. Chest discomfort, it's not always pain. It's not that gripping, squeezing, crushing pain. It can be more of a subtle pressure, a tightness, or burning in the chest for women. And especially if it's new or persistent. Shortness of breath, that's a classic one. Even if you're doing light activity, shortness of breath, that's not right. Nausea, sweating, or dizziness. So that clamminess, especially if it's in combination with any others that I've mentioned here, they shouldn't be ignored. Heart palpitations. So especially if it's new or paired with dizziness or fatigue, it's one to look out for. Swelling or discomfort in the abdomen. I wouldn't have known that one. And this can be when there's heart failure happening and the heart is struggling to get that blood around the body. So don't dismiss these, get some help. And so, for example, if you're calling for an ambulance, it's really important, or on behalf of someone, to say, I think that person is having a heart attack. Be really clear, and then they know to action that. So I trust that's helpful for you or someone you know. Looking forward to hearing from you. Ciao for now.